Hi guys, this is Dr. Bhupesh from Dr. BKM Institutes. Again, this week is majorly dedicated to the reading task and I will try to record whatever is possible from my side, whatever the questions we will do. Again, Dr. BKM is all about giving you the solutions, how to do your questions. We don't create question papers. Like this is from one of the authentic readings. Thanks to OET for creating these kind of question papers. So I'm just going to take this question again. My job is to teach you how to attempt and how you can make your reading easy. So please follow this question. So first of all, read the question. When is it acceptable for a health professional to pass on confidential information given by a patient? So it's a very simple question, that when is it possible for a nurse or for a doctor to pass on the confidential? So being doctors and nurses, are we allowed to pass the information, or in any circumstance can we pass the information? So let's see. Where a patient objects to the information being shared with the other professionals involved in their care, you should explain how disclosure could benefit the continuity of the quality and care. So we can share the information if it is important, and we need to explain it to the patient. If their decision has any implications for the proposed treatment, it will be necessary to inform the patient of this. So you should explain the patient how disclosure would benefit. Then patient, whatever the decision patient will take, it can be good or bad. So if patient says no, then you have to tell them it is necessary to inform this. Ultimately, if the patient refuses, you must respect their decision. And that is what my question is: when is it acceptable for a healthcare professional to pass on the confidential information? So one thing it is saying, ultimately if patient refuse, then you should not pass the information, even if it means that for the reasons of safety you must limit your treatment options. So even if you have to limit means even if you have to use the less treatment options, even then it's fine. Even if you have to compromise the safety, then also if patient says no, it means no. If patient refuses, ultimately if patient refuses, you must respect their decision, even if it means that for the reasons of safety you must limit treatment option. So even if it is limitizing the treatment option, then also you should not go forward. You should record their decision within their clinical notes. So whatever the patient will say, we will do that. If patient says no, that means no, you cannot share the information. It may be in the public interest to disclose the information received in the confidence without consent. So that is what my question is. When can we pass the confidential information? So here is the word, if you would see. These are the small hints that you have to capitalize. These are the words you should be careful about capturing, because this paragraph is not that important, but this confidence. So you can disclose. Disclose means you can share the information without consent. For example, if the information about a serious crime, it is important that the confidentiality may only be broken in this way in exceptional circumstances, that we can break the confidentiality in the exceptional circumstances, and then only after careful consideration. That means a medical practitioner or a nurse can pass the information after careful consideration. This means that you can justify your actions. That means when patient or anybody will ask you why did you share the information, you should be able to justify and point out the possible harm to the patient or other interested parties. And you should have the reasons that you shared the information because it could have harmed the patient or the other interested party if you would not have disclosed the information. Theft, fraud, or damage would generally not warrant a breach of confidence. So in the cases of theft, fraud, and damage to property, you can share the information. So obviously I understand, please, it's not difficult. I have read the same thing. I'm talking in English. I'm not even converting it in Hindi. It is very simple to understand that if patient says no, you should not share the information. But in case of crime, in case of exceptional circumstances, if you can justify your actions, then you can share the information. So if the non disclosure could adversely affect those involved. So that is what OET is all about. This is a tricky option. But if you will understand, non-disclosure means that if you do not disclose the information, it could adversely means it could means possible. I can do it. I can do it. Can means possible. I could do it. That also means possible. So possible here is replaced by could. Adversely is replaced by harm. But again, OET elimination method is much easy. Suppose if you do not understand this, so you leave it. Just don't study it. Let's see the other options. If the patient treatment might otherwise be compromised. So let's read the whole sentence. When is it acceptable for a health professional to pass on the confidential information? If the patient treatment might otherwise be compromised. So if the patient treatment is compromised, so a health professional should share the information. Over here it is said, even if the patient treatment is compromised, even if you have to limit your treatment options, if patient says no, you cannot share. So this is not my answer. क्योंकि ऑप्शन में यही दिया है that confidential information should not be shared if patient says no, even if you have to limitize your options. So even if you have to compromise the treatment, even then you cannot share. Third option, if the healthcare professional would be breaking the law. In this, there is nothing like that healthcare professional is breaking the law. So there is nothing like this that has been given. So the only confusion can be between A and B a little. But if you will study the A, if non-disclosure could adversely affect those involved, then it is important for a health professional to pass on the information. So that is what is the point. If it could possibly harm the patient or the other interested parties, that means those involved. So the people who are involved, if it could harm them, then non-disclosure, then you can, kind of disclose the information. So that is the point. So that is how OET questions are little tricky, but I understand I have spoken in English, so it can be difficult. Now I will speak in Hindi for all the people. हमें क्वेश्चन में ये पूछा है कि हेल्थ केयर प्रोफेशनल इंफॉर्मेशन को कब पास कर सकता है। इसने कहा हेल्थ केयर प्रोफेशनल इंफॉर्मेशन को पास नहीं कर सकता चाहे ट्रीटमेंट कॉम्प्रोमाइज हो जाए, चाहे ट्रीटमेंट को आपको लिमिट करना पड़े। तो जो सेकंड ऑप्शन है यही कह रहा है कि ट्रीटमेंट को कॉम्प्रोमाइज करना पड़े तो इस कारण से डिक्लेयर कर दो इन्फॉर्मेशन। तो उसने कहा नहीं, ट्रीटमेंट कॉम्प्रोमाइज होने के बावजूद भी डिक्लेयर नहीं करनी। सिर्फ एक ही केस है, जब क्राइम की बात है, जब आप जस्टिफाई कर पाओगे अपने एक्शंस को। अदरवाइज अगर आप डिस्क्लोज नहीं करते तो कुछ एडवर्स इफेक्ट हो जाता, तो उस केस में आप इंफॉर्मेशन शेयर कर सकते हो। नॉन डिस्क्लोजर, इफ यू वुड नॉट हैव डिस्क्लोज, यहाँ पे नॉन डिस्क्लोजर वर्ड कवर होता है। कुड मीन्स पॉसिबली, एडवर्सली अफेक्ट मीन्स हार्म, others involved means these other interested parties. So ये मैच करना आपके लिए मुश्किल रहेगा, इसीलिए मैं इसको एलिमिनेशन मेथड बोलता हूँ कि पेशेंट का ट्रीटमेंट कॉम्प्रोमाइज हो सकता है तो इन्फॉर्मेशन को शेयर करना है, नहीं करना। तो यहाँ पे ये ऑप्शन हमारा आंसर नहीं हो सकता था। सो दैट इज हाउ यू शुड डू ओईटी रीडिंग। ऑब्वियसली इट इज लिटिल चैलेंजिंग, बट इट इज डेफिनेटली पॉसिबल। और ये क्वेश्चन सच में इट इज नॉट अ डिफिकल्ट क्वेश्चन, मे बी इट्स द फर्स्ट क्वेश्चन ऑफ द वीक, दैट इज वाई मैं थोड़ा ज्यादा बोल रहा हूँ, बट आई विल ट्राई टू रिस्ट्रिक्ट माई वर्ड्स। लेकिन हमेशा क्वेश्चन को पढ़ना है, हेल्थ केयर प्रोफेशनल कब शेयर कर सकता है, ट्रीटमेंट ऑप्शंस के चक्कर में नहीं, ट्रीटमेंट ऑप्शंस के चक्कर में नहीं कर सकता। हेल्थ केयर प्रोफेशनल तब कर सकता है जब अगर वो डिस्क्लोज नहीं करता तो जो इन्वॉल्व लोग हैं, अदर इंटरेस्टेड पार्टीज हैं, उनको कोई हार्म होता हो तो ये वाला ऑप्शन मैच कर रहा था। इट इज दैट सिंपल, अगर हम माइंड को कॉम्प्लेक्स ना करें। कभी कभी मुझे आपको पढ़ाने के लिए समटाइम्स टू टीच यू आई हैव टू मेक इट कॉम्प्लेक्स बिकॉज आई हैव टू गो इन डिटेल, अदरवाइज इट्स अ वेरी सिंपल ब्लैंक। बट दिस इज द फर्स्ट क्वेश्चन ऑफ दिस वीक, सो कोई बात नहीं, वी विल गेट इन द फ्लो एंड अदर क्वेश्चंस विल बिकम इजी. So this is Dr. Bhupesh from Dr. BKM Institute. Again, I will take your point of views after stopping the recording. Please subscribe our channel if you have not. Thank you.